In this simulation, we have a patient in the MD-PNP ICU. Okay, we need to stop sharing. There we go. We have a patient at the MD-PNP ICU, and you'll see the devices include a Sapphire infusion pump, Medtronic PB980 ventilator, and a Philips bedside patient monitor set up here with a mannequin. And you'll see these in some more detail as the bedside nurse, Dave Arney, played by Dave Arney today, will show you. And then the remote physician will be able to control the ventilator using the PB980 remote control software and the infusion pump remote control and vital signs display software using Open Ice. So with that, we're going to switch over now to the camera view, and we'll begin with the bedside nurse, Dave Arney. Begin simulation.
Hello and greetings from the MD-PNP ICU. I'm going to walk through the equipment setup a little bit before we actually start the simulation. So here we have our patient on the bed, our patient Rodney. Rodney is connected to a A10 Medical Sapphire infusion pump receiving norepinephrine, a Medtronic PB980 ventilator, and a Philips MX800 patient monitor. The ventilator is connected to a lung simulator, which is hidden behind it, and the patient monitor is connected to a Fluke electronic patient simulator, which is creating the vital signs that we see on the screen. These devices are connected through two parallel systems. All of the devices are connected to our Open Ice research interoperability platform, and the ventilator is also connected to a Medtronic remote control software for non-clinical use here in the lab. So, having set the stage, we'll now start our scenario. So I am the nurse in this room. I'm not very familiar with this particular ventilator or how to change it or how to help this patient, but I know that their oxygen saturation is low and that their blood pressure isn't great either. So I'm going to call for a remote teleconsultation and ask for some help.
Hi, this is Dr. Lee from the tele-ICU consult service. I'm joined by my RTE here. How can we help today?
I've got a 48-year-old male patient who's on a ventilator on pressure support. Their oxygen saturation is not great. It's at 84, and their blood pressure is also a little bit low. I'm not very familiar with this ventilator, and all of our RTs are busy with other patients, so I need a little help to do here.
Happy to help. Is it possible for you to give us access to your monitoring capabilities?
Yes, please go ahead.
On my screen here now, I can see that we have access to all the ventilator monitoring, vital signs, and also your infusion pumps. It looks like we should increase your PEEP from 5 to 10. I know your RT is busy. Is it okay if we control it from our end?
Yes, please.
Okay. Yi, are you able to change the PEEP from 5 to 10, please?
Yes.
And let's send the command when it's ready.
The PIP currently is set as 5.
Yes, and let's increase it to 10.
Let's change that to 10. I will send it the control.
Perfect. How are you doing over there, Nurse Arney?
Yes, I see that the PEEP is changed on the ventilator, and I even see the change in the waveform.
Perfect. How's the patient doing?
Their saturation is going up a little bit, but I noticed that their blood pressure is also starting to drop.
Yeah, it looks like the blood pressure is dropping. We can see that on our end as well. I think that your current infusion rate for the norepi is at 15. I think we should increase it to 30. Would it be okay for us to change it on our end?
Yes, please go ahead.
Okay, let's increase from 15 milliliters an hour to 30, and let's send the command.
Okay, the command is sent.
Okay, I'm checking back in. How
So
are you guys
now
doing?
we're going to go to our next simulation.
Let's see. I'm watching. I see that the pump has changed its rate and is now running at 30. And I'm looking at the blood pressure, and I see that the blood pressure is already starting to come back up.
Perfect. Please let us know if you need anything else. We're on standby to help at any point.
Okay, great. Thank you very much.
End simulation.